Welcome back to Wally's Nursing Videos, your go-to resource for all things nursing education. Today, we're diving into the fascinating world of anxiety and stress and their impact on our mental and physical well-being. Let's start by unpacking what anxiety really means. It's that uneasy feeling, that sense of apprehension or dread, which can be hard to pinpoint. And it's important to distinguish anxiety from fear, which is a response to a clear and identifiable threat. Anxiety disorders, however, involve excessive anxiety coupled with various behavioral, emotional, cognitive, and physiological responses. Now, let's talk about stress. Stress is the wear and tear that life puts on our bodies, triggered by demands or perceived threats. We'll explore the general adaptation syndrome, a theory by Hans Selye that outlines how our bodies respond to stress in 3 stages: alarm, resistance, and exhaustion. Moving on to managing anxiety levels as nurses, it's essential to be aware of our own anxiety levels and to assess those of our patients. Using simple, clear language can aid communication, especially when anxiety levels are high. We'll learn techniques to help lower anxiety levels, such as speaking in a calm, soothing voice and ensuring our patients feel safe and supported. In cases of severe anxiety, ensuring the patient's safety is our top priority. Sometimes, short-term use of anxiolytics may be necessary to provide immediate relief. These medications are vital tools in the treatment of various conditions, including anxiety and anxiety disorders, insomnia, obsessive-compulsive disorder, OCD, depression, post-traumatic stress disorder, PTSD, and alcohol withdrawal. 2 main classes of anti-anxiety drugs we'll be discussing are benzodiazepines and buspirone. Benzodiazepines work by enhancing the activity of gamma-aminobutyric acid, GABA, a neurotransmitter that inhibits brain activity, leading to sedation and relaxation. On the other hand, buspirone exerts its effects through partial agonist activity at serotonin receptors, providing anxiolytic effects without the risk of dependence associated with benzodiazepines. Now, let's delve into the side effects of these medications. Benzodiazepines, while effective, come with potential drawbacks, including physical and psychological dependence, central nervous system, CNS depression, a hangover effect, and the development of tolerance over time. Similarly, buspirone may cause side effects such as dizziness, sedation, nausea, and headaches. When it comes to educating our patients, it's crucial to emphasize safety measures, such as avoiding alcohol and the importance of gradual discontinuation rather than abrupt cessation, which can lead to rebound symptoms. It's important to highlight the potentially fatal consequences of abrupt benzodiazepine discontinuation, as it can lead to seizures, especially in individuals who have been using high doses or long-term therapy. Now, let's shift our focus to the prevalence and types of anxiety disorders. Anxiety disorders encompass a range of conditions, including agoraphobia, panic disorder, specific phobia, social anxiety disorder, social phobia, and generalized anxiety disorder, JD. These disorders have some of the highest prevalence rates among all mental health conditions in the United States, affecting more than 1 in 5 individuals. They are more prevalent in women and people under 45 years old, with onset and clinical course varying widely among individuals. It's also essential to recognize related disorders such as selective mutism, anxiety disorders due to another mental condition, substance medication-induced anxiety disorder, and separation anxiety disorder, which can further complicate diagnosis and treatment. Let's continue our exploration by examining the various etiological factors and cultural considerations surrounding anxiety disorders. Anxiety disorders, etiology, biologic theories. These theories suggest that biological factors play a significant role in the development of anxiety disorders. Genetic predisposition is one such factor, with studies indicating a hereditary component in certain anxiety disorders. Neurochemical theories. Neurotransmitters like gamma-aminobutyric acid, GABA, and serotonin have been implicated in anxiety disorders. Dysregulation of these neurotransmitter systems can contribute to the manifestation of symptoms. Psychodynamic theories. Freudian psychoanalytic theory proposes that anxiety stems from unconscious conflicts between primitive desires and societal norms. Defense mechanisms, such as repression and displacement, are employed to manage these conflicts. Interpersonal theory. Developed by theorists like Harry Stack Sullivan and Hildegard Peplau, Interpersonal theory suggests that anxiety arises from dysfunctional interpersonal relationships. Maladaptive interactions with others can lead to feelings of insecurity and anxiety. Behavioral theory. This theory posits that anxiety disorders result from learned associations between stimuli and fear responses. Through processes like classical conditioning and operant conditioning, individuals may develop maladaptive patterns of behavior in response to anxiety-provoking situations. Cultural considerations. Every culture has its own norms and beliefs regarding the expression and management of anxiety. In some cultures, anxiety is often expressed through somatic symptoms such as headaches, backaches, fatigue, dizziness, and stomach problems, rather than through verbal communication of emotional distress. Conversely, in other cultures, anxiety symptoms may be attributed to supernatural causes or bad air. As nurses, it's essential to practice cultural humility, which involves being aware of cultural differences without resorting to stereotypes. This means acknowledging and respecting the diverse ways in which individuals experience and express anxiety and tailoring care accordingly. By embracing cultural humility, nurses can foster trust and rapport with patients from different cultural backgrounds, ultimately enhancing the quality of care provided. Treatment options available for anxiety disorders often involve a combination of medications and therapy. Combination of medications and therapy. Many individuals with anxiety disorders benefit from a combination of pharmacological interventions and psychotherapy. This approach addresses both the underlying neurochemical imbalances associated with anxiety and the maladaptive thought patterns and behaviors that contribute to its maintenance. Medications, including antidepressant medications, particularly selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed for anxiety disorders. These medications work by increasing the availability of neurotransmitters such as serotonin and norepinephrine, thereby alleviating symptoms of anxiety and improving mood. Additionally, benzodiazepines may be prescribed for short-term relief of acute anxiety symptoms, although their long-term use is generally discouraged due to the risk of dependence and tolerance. Cognitive behavioral therapy, CBT. CBT is a widely used psychotherapeutic approach for treating anxiety disorders. It aims to identify and challenge maladaptive thought patterns and behaviors that contribute to anxiety, replacing them with more adaptive coping strategies. Several techniques are utilized in CBT for anxiety, including positive reframing. This involves identifying and reframing negative or irrational thoughts into more positive and realistic ones. By changing the interpretation of situations, individuals can reduce anxiety and improve their overall well-being. Decatastrophizing. This technique involves challenging catastrophic thinking patterns by making a more realistic appraisal of the situation. By recognizing that feared outcomes are unlikely or manageable, individuals can reduce anxiety and regain a sense of control. Assertiveness training. Assertiveness training teaches individuals to communicate their needs and boundaries effectively, assertively expressing themselves in interpersonal situations. By learning assertive communication skills, individuals can reduce anxiety related to social interactions and improve their self-esteem. Now, let's explore age-related considerations in the diagnosis and treatment of anxiety disorders. Age-related considerations. Conditions seen in children. Anxiety disorders can manifest differently in children compared to adults. Selective mutism, where a child consistently fails to speak in specific social situations despite speaking in other settings, is one example. Separation anxiety, characterized by excessive distress when separated from caregivers, is another common anxiety disorder seen in children. Social anxiety disorder in adolescents. Social anxiety disorder, characterized by intense fear of social situations and scrutiny by others, can persist into adulthood if left untreated. Early intervention with appropriate therapies can help alleviate symptoms and improve outcomes. Late-life anxiety disorders. Anxiety disorders can also affect older adults, although they may present differently than in younger populations. Phobias, such as agoraphobia, fear of open or crowded spaces, and generalized anxiety disorder, GAE, are among the most common anxiety disorders in late life. Panic attacks are less common in older adults, but may occur in the context of other medical conditions or as a reaction to life stressors. Ruminative thoughts. Older adults may experience ruminative thoughts characterized by repetitive and intrusive worries or concerns about past events or future outcomes. These thoughts can contribute to feelings of anxiety and distress. Treatment of choice: selective serotonin reuptake inhibitors, SSRIs. SSRIs are often the treatment of choice for anxiety disorders in older adults due to their favorable side effect profile and efficacy. These medications work by increasing serotonin levels in the brain, thereby reducing symptoms of anxiety and improving mood. However, it's essential to monitor for potential side effects and drug interactions, especially in older adults who may be taking multiple medications. Panic disorder. Panic disorder is characterized by discrete episodes of panic attacks, which are sudden and intense periods of fear or discomfort that arise without any identifiable trigger or stimulus. A diagnosis of panic disorder is made when these panic attacks recur unexpectedly and are followed by at least 1 month of concern or worry about future attacks. It's noteworthy that half of individuals with panic disorder also experience agoraphobia, a fear of being in situations where escape might be difficult or embarrassing. This can lead to avoidance behaviors, impacting daily functioning. Panic disorder is associated with an increased risk of suicidality, highlighting the seriousness of this condition. Individuals may engage in avoidance behaviors to prevent future panic attacks, further affecting their quality of life. Treatment. Treatment options for panic disorder include cognitive behavioral therapy, CBT, which aims to identify and challenge maladaptive thought patterns and behaviors associated with panic attacks. Additionally, relaxation techniques such as deep breathing and progressive muscle relaxation can help manage symptoms during panic attacks. Medications may also be prescribed, including benzodiazepines, selective serotonin reuptake inhibitors, SSRIs, tricyclic antidepressants, and certain antihypertensive medications like clonidine and propranolol. Panic disorder and nursing process application. Nurses play a crucial role in assessing and managing panic disorder using the nursing process. Assessment involves utilizing tools like the Hamilton Rating Scale for anxiety to evaluate the severity of anxiety symptoms. Nurses gather a comprehensive history and assess various aspects, including general appearance, mood, thought processes, and self-concept. Data analysis and prioritization help nurses identify common problems related to panic disorder, such as safety concerns and impaired coping mechanisms. This guides the development of individualized care plans. Outcome identification involves setting realistic goals in collaboration with the patient, focusing on symptom management and improved coping skills. Actions taken by nurses include promoting safety and comfort, using therapeutic communication techniques, managing anxiety through relaxation techniques and medication administration, and providing education to patients and their families about panic disorder and its management. Evaluation involves assessing the effectiveness of interventions and revising the care plan as needed to ensure continued progress. Phobias. Phobias are characterized by intense, illogical, and persistent fears of specific objects or situations. The response to these fears is often out of proportion to the actual threat posed by the object or situation. Phobias are categorized into different types, including agoraphobia, specific phobia, and social anxiety or phobia. Specific phobias can be further categorized based on the nature of the fear, such as phobias related to the natural environment, blood injection injury, situational phobias, animal phobias, and other specific phobias. Treatment options for phobias include behavioral therapy techniques such as positive reframing, assertiveness training, systematic desensitization, and flooding. Medications may also be prescribed in some cases to alleviate symptoms. Mental health promotion. Anxiety can serve as a warning sign that stress is not being effectively managed. It's important to recognize that even positive events can be stressful, and effective stress and anxiety management are crucial for overall health and well-being. The goal is not to eliminate anxiety entirely, but rather to manage it effectively. Tips for managing stress include maintaining a positive attitude, believing in oneself, accepting that certain events are beyond one's control, practicing assertive communication, and expressing feelings through talking, laughing, or crying. Additionally, learning relaxation techniques, setting realistic goals, engaging in personally meaningful activities, maintaining a well-balanced diet, exercising regularly and ensuring adequate rest and sleep are essential for stress management. Limiting the intake of caffeine and alcohol and utilizing stress management techniques can also be beneficial. Self-awareness issues. It's important for nurses to understand how anxiety behaviors manifest and affect individuals. Nurses themselves are susceptible to stress and anxiety, and it's essential to recognize that everyone experiences these emotions occasionally. Rather than trying to fix a client's problem, nurses should focus on providing support and guidance in managing stress and anxiety effectively.